Bump in lip after Juvederm. Any suggestions? I got my lips injected with Juvederm around 3 weeks ago. Everything was fine and even, however, a few days ago, a bump formed in my upper lip. I don't want to get hyaluronidase because I'm scared it will make things even more uneven. What should I do?
Thank you for your question. You stated in your question that you had Juvederm about 3 weeks ago, and that recently you developed a bump in your upper lip, and that you're concerned about it, but you're afraid of using hyaluronidase because you're afraid it might make things worse. Well, certainly I can give you some guidance as to how these types of situations are managed in my practice. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon, and practicing in Manhattan and Long Island for over 20 years. Lip enhancement is a big part of what we do with fillers such as Juvederm, and certainly this concern is not uncommon. So I would suggest that first of all you would want to communicate with the doctor who performed the procedure. A lot of times it is best to go back to the original doctor who did the procedure, because a lot of times they have their own individual style with how to approach this type of issue. Although the principles are still constant, but sometimes the approaches can have some variability. So to begin with, I would say that the fact that the collection occurred, the bump occurred relatively recently, but it's still just about 3 weeks out, you may have an opportunity to be able to massage this area down. A lot of times with hyaluronic acid fillers, and of course hyaluronic acid fillers have different viscosities, and a lot of times the thicker fillers such as Juvederm are chosen for their longevity, but because their viscosity, when they kind of collect, they become kind of hard. In your situation, it may be amenable to just the movement of the mouth as you're speaking and talking. There's often this small movement. It could be described as kind of like the tide polishing a stone. Like an area that is elevated can kind of soften up with the action of muscles working over and over this area. Now, if this still is relatively problematic or feels like a hard ball, then going back to your doctor may be able to manipulate and massage the area to try to even out a little bit better. It's a little bit hard at 3 weeks. Usually when we do the sculpting part of this procedure, we see the patient, we do it at the time of the procedure. But the thing about lips is lips can also swell fairly quickly, and sometimes it's not always easy to tell if the material is distributed in the desired way. Now, as far as hyaluronidase is concerned, certainly if an area looks unusual or doesn't look right, then I think hyaluronidase is a good option. Hyaluronidase can be delivered in a very small amount, and you can really reduce the material to a level that would be hopefully appropriate. Certainly your fear is well founded that hyaluronidase can also dissolve more than you want and dissolve some of the filler that you want to have around. But unfortunately, that's sometimes the balance that you have to accept when you start doing procedures like this. It is part of the reality that if you want to have a certain augmentation, and if the tissue and the material does collect in an undesirable way, then if massage doesn't work and the material doesn't kind of even out, it still creates a bump, then hyaluronidase is the way to go. I think you should, again, go back to your doctor and let your doctor feel it. And a lot of times when we actually examine the patient, you can feel how hard it is, and you can get a sense of what is going on as to what you can potentially do to improve the situation. And sometimes a little bit of hyaluronidase can go a long way. So I hope that was helpful. I wish you the best of luck. Thank you for your question.